I want to bring in Dr. Amesh Adalja, infectious disease specialist and senior scholar over at Johns Hopkins Center for Health Security. Dr. Adalja, always a pleasure to have you here. Thanks so much for getting up early with us this morning. Give us some reasoning into the main study behind this. Will this really help us reach herd immunity faster?
I do think the more people that are vaccinated, the less opportunity this virus is going to have to spread through the population. But to me, I think what we really wanted these vaccines to do was something short of herd immunity. We wanted to protect our populations from developing serious disease, hospitalizations, and deaths. And that's why we targeted the vaccine to priority groups like nursing home residents or those with comorbid conditions. And thankfully, children are spared from severe disease, hospitalization, and death. So that's why they weren't part of the first part of vaccination. But I do think that this is something that we should do. It will decrease the spread. It will decrease those rare cases of children having multi-inflammatory syndrome or having severe disease. But we need to study this in children because the risk-benefit ratio is different when you're vaccinating a 9-year-old versus vaccinating a 90-year-old. And I think that's what we'll learn with these studies that are coming out.
Obviously, getting kids back into school, a very important thing for so many people. Is this going to help us open schools potentially for the fall, even if we don't have a lot of these children vaccinated?
For the younger children, no. I think that can be done right now, and it should be done right now. That means K through 8. I think we know that this is something that can be done safely. We've got the data without the vaccine to do that, and now teachers are being vaccinated, so that makes it easier to do. When you get into high school, you start to see the epidemiology of this change more towards adults, where 9th through 12th graders can spread this, and they also participate in many extracurricular activities that could be focuses of spread. So, for example, sports or cheerleading or parties or dances, all of that becomes easier if you have a vaccinated population. So I do think when you're talking about higher grades, I think it makes it easier to actually operate those schools without having the virus impinge on you. And I think that this is something that will make it easier to open schools in fall and maybe even to open sustainably, so they don't have to have any kind of shutdowns or any kind of contact tracing because there's exposures because they've got a highly vaccinated student population. But again, we need the data in order to be able to do this. And Pfizer has approval for 16 and 17-year-olds, so we've got to also count that too.
Yeah, very good point there, Dr. Adalja. I want to talk, you mentioned dances and parties. I want to talk about spring break because that's obviously a concern for a lot of people here, given the fact that these variants are spreading all over the country right now, especially in Florida right now. And we're also seeing numbers from the TSA. We had 5 million people check in at TSA over the course of the last weekend. So obviously travel demand is back up again. How are we expecting maybe a significant surge because of the amount of traveling and the amount of partying that's happening over spring break? And how concerned are you about this?
We'll likely see some uptick in cases in those individuals who aren't vaccinated, who are not social distancing. But I think what we're going to see overall in this country is a decoupling of cases from hospitalizations and deaths. As our vulnerable population becomes more and more vaccinated, we're not going to hear about hospital capacity concerns, and that's a good thing. And eventually we're going to basically have cases but not have the ability, the virus will have the ability removed from it to be able to cause serious disease, hospitalization, and death because of vaccination. And then I think we've got to kind of shift how we think about this, because what it will become is more of a tamer respiratory virus if it's not able to land people in the hospital. I think right now we don't have enough people vaccinated to say that that's the for sure trajectory, but it is likely a trend that we're going to see more and more of. But people who are going to spring break should really still think about the fact that we're still in a pandemic. They should still continue to try to wear masks, social distance, and wash their hands, and possibly get a test after they return back from spring break to make sure that they're not a carrier of this virus, because we likely will see an uptick in cases, and we don't want chains of transmission to be set off from spring break.
Absolutely. And then on top of that, I mean, the numbers we're seeing in in Europe in particular, Dr. Adalja, are incredibly frightening. Is there hope that because the amount of vaccines that we're getting right now in people's arms, over 2 million on a day, every day, is that enough really to offset potentially whatever wave that's happening in Europe coming over here?
I do think that we can't really directly extrapolate what's happening in Europe to the United States. The European countries have had a very sluggish start with vaccination. It's really dismal there compared to the United States, where we're probably the fourth fastest country to vaccinate the population. And we all wanted to go faster here, but every vaccine that goes in someone's arm takes us further and further away from that European scenario. So what's happening in Europe should really underscore the need to pull out all the stops and even go faster with vaccination 24/7, just getting as many doses into people's arms as possible. And I hopefully think that we're not going to end up having something that happened in Europe. I think this is unique to them, and it's really being fed by what's going on with their vaccine rollout.
Yeah, let's talk about that for a moment. Obviously, the AstraZeneca situation in Europe is really very difficult, given the fact that there's so much misinformation about how many people are having blood clots based off of this vaccine. And we already know so many people in Europe, Dr. Adalja, seem like they don't want to take the vaccine anyway. So how concerned are you about what's happening in Europe with this AstraZeneca vaccine?
I'm concerned about the precedent that it's setting, that you pull a vaccine based on kind of a spurious association, meaning that there's no causal link that they found between the AstraZeneca vaccine and blood clots. And what this is going to do is undermine confidence in the vaccine, because when invariably they restart their programs again, people are not going to remember the investigation or any of that. They're just going to remember that blood clot and AstraZeneca vaccine association that they heard, and that may make them hesitant to get that vaccine, which is going to further delay Europe's vaccination progress. It's not going to be as quickly as the United States. It's going to be much later. So I think Europe is going to be a place that's plagued with coronavirus much longer than it needs to be, because they're unable to vaccinate their population.
But how concerned should we be from the United States perspective? Even if we reach herd immunity here in the United States, is there a concern that because other global parts of the world aren't fully vaccinated and that virus is still going everywhere and the variants are still out there, is that a concern that then that could impact us even if we're still vaccinated?
I do think it is a concern, because if the outbreak is uncontrolled in any part of the world, it poses a risk to every other country of the world. So you may see restrictions on Europe continue. There may be travel restrictions, there may be testing and quarantine restrictions. So this is going to impede the recovery of the world to normalcy if a huge swath of it is unable to control this virus. And I do think we'll still have to be vigilant, even with vaccination, because not our whole population will be vaccinated. There will be variants that will start to grow up in Europe, because it'll be able to spread in the absence of a vaccine. So yes, I do think this is concerning for the world as such, and it's going to delay the start of our normal lives.
All right, Dr. Amesh Adalja, always a pleasure to have you here, sir. Thank you so much. He's an infectious disease specialist and senior scholar at John Hopkins Center for Health Security.